Hello and welcome to Medicasoft's discussion and demonstration of our software solution for home and community-based services. We'd like to take you through a little bit of an introduction to our team and our company, and then we'll dive into some of the details of our software and walk you through a demonstration. For starters, I'd just like to introduce some of the folks that you will hear on the phone today. I'm Mike O'Neill. I'm the CEO here at Medicasoft. We will also have Brent Welker, our CTO, take you through the software, and Monica Stout, our marketing director, is also online here with us for the discussion. I'll walk you through just a brief introduction to Medicasoft, just to give you some context for our company and some of our history and the expertise that we bring to our solution. We'll take you through our home and community-based services care solution. A quick note that we're supporting all of the required services. To give you some context on where our solution comes from, we'll actually step you through a brief introduction to our product set and the EHR and PHR space, mention some of the technology that allows us to provide this solution, and then we'll go into the meat of the discussion, which is a demo. Briefly, Medicasoft is a healthcare IT software and services company. We are bringing software solutions to the US market, but we also have a global presence and provide solutions overseas as well. We're currently serving clients in the government and commercial space, including the US Department of Veterans Affairs. We provide solutions for employee benefits for the Postal Service. For the New York State Office of Mental Health, we played a role in their deployment of the VISTA EHR, and for some HIEs, the Delaware Health Information Network, for example. As I mentioned when we started, we are supporting the complete set of home and community-based services with our solution, and we'll provide you an overview of that when we come to our demo. Medicasoft's product set includes really a full suite of services for both healthcare providers and for patients, beginning with ehr.NXT, which is our electronic health record software suite. Our HCBS solution is derived from our EHR suite. This is a meaningful use certified software suite that is built from the ground up with new technology based on standards such as HL7 FHIR. We also provide patient-facing software. Health Center is our personal health record and patient portal solution that we have deployed for both healthcare providers and for standalone implementations. Both the ehr.NXT, and our Health Center PHR are built on a common cloud-based platform that gives us the ability to bring together health record information into a single platform and provides an ability for our customers to rapidly deploy our software solutions, but also it's an open architecture that allows other analytics tools, report tools, other solutions to be easily integrated and access that universal health record. To support secure communication of health information, we're also an accredited HISP, which means that we provide direct secure messaging for our clients. ehr.NXT, as I mentioned, you'll see our HCBS solution here today, which is derived from our broader EHR suite. This is an electronic health record platform that is built to support both inpatient and ambulatory care. We took a complete new technology approach to the EHR market, which allows us to support things like better data sharing, data interoperability, team-based care. It's also allowed us to really redesign the way clinicians interact with EHRs to make them more productive and spend less time acting as clerks and more time practicing medicine. For patients, we have our Health Center PHR, which really gives individuals the ability to bring together all of their health information, whether that's health information that they get electronically from their doctor or from the hospital, or information that they may generate themselves, either by entering it in as note-taking or automatically from personal devices and wearables, such as Fitbit or any of the Apple Health devices and so on. This really gives individuals an ability to control their health information to get a picture, a better overall picture of their health and wellness, and to share that information with the people who are involved in their care. Both the EHR and PHR are built on a common platform, which for us we think is really a critical aspect of all of our software. The ability to make sure that any of the data that's required, no matter what the source is, that's required for the delivery of care to patients, can be brought together in a single common platform in a form that's clinically relevant, easy to use, and that also can be offered in technology that makes it truly easy to use. So all of our software is designed for the cloud, designed for delivery over the web. It's designed to be open, interoperable to support the sharing of data. And in that way, we think we are allowing healthcare providers to focus on medicine and to really be able to improve both outcomes and the efficiency of care. Our HISP services platform gives us the ability to send and receive health information in a secure way. We've received the accreditations necessary to handle direct secure messages, and that is something that many of our clients take advantage of. It is a service that comes completely integrated with both our electronic health record and our personal health record software solutions. Just a quick mention of some of the accreditations and certifications. The software that you'll see today and our EHR and PHR suite in general are certified for ONC meaningful use. I've mentioned the direct secure messaging accreditation. We also are accredited for the platform that holds all of the data to be cloud hosting personal health information. In order to really maintain our leading edge capability in technology, interoperability, and standards, we maintain a number of relationships that allow us to provide better services to you. This includes technical standards such as the HL7 FHIR standard. It includes functional standards such as our certification with SureScripts to deliver electronic prescribing services, and a number of other standards that help us maintain our ability to use the best of technology for the delivery of care. If we take a quick look at why we think we are an excellent partner for many of you, we've focused a lot on our ability to select and deploy modern technology so that we can put tools in your hands that let you focus on your job. We think one of the big benefits of the proper selection of modern technology is the ability to support interoperability, to share data, to integrate with your current systems, to provide a platform that you can integrate with future systems that you might select. A lot of that capability has to do with the openness of our architecture. That technology also lets us really optimize the user interface for use by clinicians. Actually, we employ quite a number of clinicians who help us design that user interface and that workflow to really let doctors and nurses focus on their jobs and not force them into being clerks. Another benefit of the technology that sometimes can be a little bit invisible to you as a user is that it's very easy to deploy, to scale, to keep up and running around the clock with very little downtime, and it helps us lower the total cost of ownership for the operation and delivery of the software. If we captured in a picture format some of the things that I've been mentioning about technology and standards and open architectures and so forth, it would look something like this. The NXT platform that I mentioned is shown at the bottom. This is where we provide a common database and common services that let us interoperably exchange health information from multiple sources and then present that data and a set of common services up to the various applications. And that includes the applications that we build, our EHR software, our PHR software. And it's also a platform that you and your IT departments can use if it makes sense for you to build your own analytics or reporting or integrate third-party applications or other applications that you might build. A quick mention of some of the technology. Since I've mentioned several times that we selected modern technology, it's fair to let you know what that is. The HL7 FHIR standard is our native internal data model. We store health information as FHIR resources in the Couchbase NoSQL database. And then our system is built on JavaScript, both on the server side using the Node.js environment and on the application side, the AngularJS framework. This technology stack is widely used in the industry. We've looked at companies such as Google, Netflix, LinkedIn, a number of others, at how they build very large, very scalable, very secure web-based and cloud-based systems. The technology stack that we've selected is the same technology stack that they use to deliver these high performance, high availability applications that we're all familiar with. What I'd like to do now is move on to the demonstration and take you through the software that we've developed for the home and community-based services solution.
My name is Brant Welker, and I'm the CTO of Medicasoft, and I will be showing you ehr.NXT and the features related to HCBS.
Generally what happens is a user, when they log in the system, they show up on this dashboard, which they can configure the way they want it to be. It just depends on what's going on. They can go here and configure it by selecting underneath their name. This, they would go to user settings, and then here they would pick the clinician dashboard. There are other modules that can be added here, but basically what's happening is any notifications are things that would be coming back. In this case, lab orders or completed orders of some kind would show up in this notifications. E-prescription notifications, that would be anything that happened with one of your patients' electronic prescriptions, such as a change order or a renewal request or something like that. And then you can have personal to-dos on here. This also combines with the flow sheet, which I'll show you a little bit later. Any to-do tasks from the flow sheet will show up on here too. And then this is direct secure messaging. So this is a way where you can send direct messages securely to another provider, so a general practitioner or maybe a specialist outside of your clinic, or even someone inside a direct secure message. This is the capability to do that. There's also a did somebody have a question? There's also a capability to do real-time chat with the people who are also on the system here, and then you can set your status as well. The next thing I wanted to show was a particular patient chart. So this patient chart section, this would show the patients that you're responsible for, and then of course it can be in a care team setting as well. So you might have some of the same exact patients as 2 or 3 other people who are on the care team for that particular patient. So that's all configured in the system through the ADT process. But let's look at a particular patient chart here. So I want to look at this one, and it's ambulatory because I want to show you how we do some of our outpatient ordering. Close this off here. Since I opened it. So what happens here is this is what we call the patient dashboard. So you immediately see general information about the patient up here. Any allergies that the patient has appear in this box, and it'll be yellow or red or green depending on how allergic they are to whatever substance that is. If you want to send a direct secure message about this patient, you can click this to send something. So it'll send a message to another provider in the context of this patient. So if they're in the system, they'll see those. And then, of course, there's some general data about the patient, their age, that sort of thing. This is facility information, who's the primary care provider, who's the person on staff. You have some basic demographic information or vitals information that shows up here on the top. This is configurable as to what you want to see here on the top. And then here is some other related requirements that are there for meaningful use purposes. So if there's a functional status recorded, a care plan for this particular patient, any reminders, alerts show up here related to drugs or something like that, like conflicting drugs, or an alert related to a lab result. Any sort of complex alerting would show up there. Patient flags, and then of course the code status, which is required for meaningful use. I don't think. Well, let me show you real quick how we do that. We have medication review, which lets a provider see all the medications that are going on for a particular patient. But I want to show you how we do this also. So during the intake process, we can go and retrieve the medication history for a particular patient, and that either comes from, you can choose whether you want to get that from the clearinghouse under pharmacy benefits management, or if you want to get it from the pharmacies, so that would be the SureScripts network, or both. And you check this here, that the patient has given consent for you to go and pull this information, because it's going to pull it from all these various places. So pulling it from the MDON clearinghouse is going to check for any medical pharmacy benefits that they have and pull that history, and the same for the pharmacies. So you would check these, but anyway, that's basically how the process works, and it will pull all that data down here into the medication list. You can also, if the patient has some other new medication, you can record that here, something that it didn't find. And then what will happen here, we'll also see any allergies that the patient has, and the list will show you any interactions or disconnects. So like if we record, let's see. So we put that in there, and if we go down here, just to so if it happens to be something that they have, the allergies are here, the medications show here. We would see any other medications here, and we could decide what medications need to be on the list. So, and that's done by actually completing this whole med intake, which I just deleted. But and then that would show here with our MedRec history. The next thing I wanted to show is how we just do med orders in the first place. So we have, let's say, we're gonna order something. What you're seeing here is this is the formulary coming back from SureScripts. So we would see like what the patient's insurance covers, whether it's not on formulary. Sometimes, depending on the insurer, there's multiple benefit levels from 1 to 10. 1 is always the preferred. So some insurers will have like 2 or 3 different levels, and you would see a 2 or a 3 or a 4. If something's not on formulary, it shows up here at all, like if it's completely unknown to the formulary. Then we're automatically told which fields we need to complete. We start seeing, let me go pick a different. Set the dosage. It automatically starts to set to a 30-day supply, which is normal for outpatients. Maybe we set it just. You can see any allergies or anything that exceeds the dosing recommendation will show up here. And then if you want more information about why it's like that, you can go and see that. It shows up in the education information here. So if the clinician needs that on the fly as to why these errors are showing up. But you can also override the alerts, like, or you're not forced to accept them. And then what happens though is you can order multiple things. So we ordered that one medication, but maybe we want a blood panel done too, which I spelled it wrong. So we can also order a lab test at the same time and save that. We could also order imaging or a meal change, any of that kind of stuff. And then you could save all of these orders at once. So the clinician could come in and do them all at once and then just sign for all of them once, or you could sign some of them later. So you sign them all at once like this, instead of having to order like all the medications and then go to a different screen and order all the lab tests you need, then go to a different screen and order all the imaging you need, order your different diet, if different surveys are required, if you want vital signs checked every 2 or 3 hours, all of that stuff can be done from this one ordering screen instead of requiring them to go to multiple places. And again, you will see the alert show up for something that shows up as either an allergy or dose, anything that doesn't fit the security safety rules that are within the system. So this is where you could send the prescription to SureScripts or not. The next screen I wanted to show any conditions that would show up here, and this screen is all completely configurable as well. You would have any conditions show up here, any symptoms or things that they're working social history, all of that kind of stuff, family history. So if they have related conditions in their family history, you would have access to that information here. And you can also add it. If you have a new allergy you want to add, you could put that in here. And then the latest lab results, you would see those here, and you would see trends of how they're going, which this is very interesting to the clinicians when they're trying to treat a particular condition. So we can see how things are trending. So even in behavioral health scenarios where certain medications have lab results tied to them, we can see how they're trending. So like a liver function test or something related to certain medications, just to make sure that liver damage isn't being caused. Clinicians look for that stuff over time. So you can see a quick view of those labs here, but we can also go and see all the labs and which ones are showing high, which ones are not. We could decide to graph those results just by clicking on them. We can see 2 or 3 graphs at once. It just depends on what you want to see. You can determine how much data you want to see on these graphs. That's all up to you. And then the other thing that we were talking about earlier is being able to do medication reviews. So we can see what medication has been prescribed for the patient, whether it's gone to the pharmacy, how we want to handle that. But I think the next thing I wanted to show was how we enter vital signs, and BMI and that stuff, which was interesting to you. So as a clinician on this board, we don't have vital signs, but a nurse would most likely do that, or some other care worker. So we'll just add that real quick to this person's settings by going over here to the patient charts, choosing vitals, simple lists, put it in there. Keep moving it back. All right. So one of the ways that happens is by going down and just wanted to show you this cool feature real quick. So on the flow sheet, we have different capabilities here where we can look at various things that need to be done on a particular patient at any one time. So if we go to like this board, we can see a set of patients, where that patient may be located, like if they're in a particular classroom or whatever, things about that patient. And this is configurable by you as to what you want to see on these boards. But if we were to go and look at say, David Cross here, which we were looking at a different David Cross earlier, and then we were to look at the flow sheet, we could see that he's due to have certain medications at certain times, and you can even do things like what we were talking about before. We can have tasks to mark them for morning attendance or afternoon attendance or both, depending on how that needs to take place. But we could also have a task to take vital signs for that patient, and maybe we go in and I got this backwards, sorry. So BMI would automatically be calculated. If for some reason you need to comment on one of these vital signs, you can add a comment here. It's just sometimes people want to comment like they were having problems with blood pressure, cuff, or whatever. You can comment there. Those vital signs will show up on the flow sheet. If they've been set as a task that you need to check somebody's weight every day at a certain time, that would show up on that care group's task list that they need to go and do that. And then when they look at this flow sheet, they would see the task results here and future tasks over on this side. And the same thing goes with the medication. So certain times of day, certain patients will need to take certain medications. We have a way to handle full barcode medication administration. So what would happen is you would just click on here. You could also mark that you didn't do this task, depending on what's going on. But you would scan the patient's barcode with the barcode reader right here. If you don't have access to the barcode reader, for some reason you need to override this for emergency reasons, this is tracked in the audit log, but you could go ahead and it's going to verify you have the permissions, but to do so, like a MD or a nurse could override that. And again, that's also configurable. So you can say who has the permission to do the override. So here, the first thing you would do is you would scan the patient. You would scan the medication, because the medication all has barcodes on it. You can also, if your scanner's not working, you can write the number under the barcode, which is an RX norm code. I don't know that off the top of my head for bupropion that we just added a couple seconds ago. But, and again, if that's missing, if you have the right rights, you could override. You notice that we're doing this a little late. We should have done this within the 15-minute window around 1:30 when it was due. So it's still showing wrong time, but it's going to let us go ahead and override that if we want to do that.
It does. So what happens is it went from medication was due here to we gave both of these medications at 1:51. But remember, before it said they were due at 1:30. If we went and changed this to show a tighter interval, I think. Let's see. We can get. Well, that's too tight. That's every minute, but we can see where you can see that you can set that however you want it to be during the day when you're looking at this flow sheet. But it can also be that you want to give certain surveys or something during the day. You can add personal tasks for that patient here. And you can, but any other things that the care team has decided need to be done for that particular patient can be added on here, and what time of day they should be done. And where that becomes interesting is where when we look back at these boards, we can see what needs to happen with those patients. So the first one is this tracking and flow board, which shows my patients, and I can put what data I want on here. But the other one is this follow-up board, and that's showing you tasks that weren't done for a particular patient, like this guy doesn't have his wristband printed, or it could be dressing change, or it could be just some questionnaire that you wanted to ask the patient, or some test that you give the patient every day, some sort of cognitive test or something. Those would show up on this list. So it makes it easier for the staff to know, oh, I need to go do these things for that particular patient before the end of the day. that kind of stuff. So these can be very useful for getting all the tasks done in the period that they need to be done. But these boards are something that you should view as dashboards to monitor and manage your facility, and they're customizable by you, and they're customizable for different needs, and you do that here with the board templates.
What you would do is the boards are built based on, like the one we were looking at is who has appointments minus 7 days from now or plus 7 days from now. And that's how a patient gets on the board. And a patient gets off the board basically the same way that are not within 7 days. But you could change that by anything. You could have it just patients that are coming in today, and then you can determine what columns you want to be available based on all the data that's in the system. So you can configure exactly what you want to see and how you want to monitor and manage your patients. And it could even be quality measure based, that you want to track various quality measures. But maybe you want to have also different boards that are based on a diagnostic condition. So we could also create a disease management board that is based on a specific condition. So maybe a specific type of depression or anxiety, or maybe you have a group of diabetic patients that also have some other condition, or whatever it is. You can build these specific boards to track specific patients. You can also decide what types of users based on role have access to certain boards. So you could say that, I don't know, a certain type of social worker has access to the board, to a certain type of board, or maybe it's a board just for social workers, or maybe it's a board just for nurses. Whatever it is, you can set those up. You can also set them up to be facility specific. So if you have 15 different facilities, maybe you want one chart that you measure one specific thing at that facility. But the whole idea is to have the type of dashboarding capability that lets you manage what's important to you at that facility. But there's three main types. There's our inpatient boards, which would be, you would use these most in your facility where you do things like you have people coming in every day, even though it's kind of an outpatient facility. You still have basically the same people coming in, day out. You would still use the inpatient boards, right? The ambulatory boards are more meant for an appointment type setting. So where somebody's going to be seeing a clinician for a specific amount of time per day, and you're managing more. It's more schedule driven. The other type is of course the follow-up boards, which is more of a task-based board where you're trying to track any task that didn't get done. But you can decide what information you want on these, and how you want to track them, and even what fields should be there, what order they should be in, and then some of these fields are even configurable, like that one. Just you can change the label, but this one you could determine, well, what vital signs do you want to show up in the vital signs column, that sort of thing. So all of them are configurable. You can also add comments right on the board. Like let's go back here to the inpatient board. And see, that one's. I think it's this one that I've configured comments on. Yeah, right. So here, I mean, you can just make the change right on the board. Why have to open the note module? You can just type right in your note. That's right there, instead of having to go and save it someplace else. Or maybe you're going to just change the location of this person. Well, just change it here, why have, whoops, I clicked on the picture. Why have to go and change it over in the other area? So we can, I deleted him from exam room 4, and we could put him someplace different. Maybe put him in exam room 1, but that could easily be different classrooms or a different test room or something like that. I think we need to move on, or I'm going to run out of time, because I can sit here and talk about these features all day long. But so one last thing I wanted to mention, because we were talking about medication administration. We meet all of the ONC requirements for medication reconciliation or administration, and so it's showing all those alerts based on that. We've built in some other things, because there is oftentimes that medication isn't administered exactly when it's supposed to. So the clinician has the ability to put in, well, here's the time when they administered it, and that sort of thing. The other one that we wanted to talk about was how do you do assessments? So if we go and look back at the patient's cover sheet, we have this concept of questionnaires. You can add as many different types of questionnaires as you want. You just go here. You have to choose from, there's a couple of pre-built ones that I have here in my demo system, but you could pick, if you have other questionnaires that you like to use all the time, you can put those in here. And then you fill these things out, and it'll guide you through the process of completing it. I'm not going to complete this entire one because we're running out of time, but basically it will force the caregiver to fill all these in. I'll pick a completed one. Looks like this, where you fill them in and it shows the scale, and the results are available in the system. And you can also see when it was done. You can pull those results out and use them in reports if you'd like. The next thing we were talking about is care coordination. So I wanted to be able to show, we have documents here in the system. And again, you can move these around wherever you want. Like it's really up to the clinician to set these things up as to what's important to them. So if this documents tool is something you use a lot, you can move it over here up into the upper right corner. Maybe you don't care about all these orders. You can even take that off completely. Every clinician can configure that right here under user settings. But to upload a document, it's as simple as picking the file. I'll go and pick something off my local computer here. So maybe I'll use this authorization request form for HCBS and save it. It's going to upload it to the system, and there it is. We'll be able to view any PDFs or Word documents or anything like that. You'll be able to view. But the other thing is just to make this simple, you don't want to have to upload worry about uploading true clinical documents to a different place. So you can also go here and upload a CCDA that you might have received from another provider. If we go down here, I have my CCDA, and if I upload that, if we go to view this, we should be able to view it in this. We'll see the CCDA. Now this data, this is all coded data in this form because it's a true clinical care summary document. It would be possible, the system recognizes that it has coded data. I can import it right in the system by clicking this one button. I can also download it and send it to somebody else. Maybe I want to send it to somebody else via direct secure message. If that's configured, I can do that. I can also delete those from the record And then, of course, there's an expanded view of even this module if I want to see them all like this, who uploaded them, that kind of thing. But it could be any type of viewable document, whether it's a Word document, an Excel spreadsheet, an XML document, if it's a clinical care summary document like a CCDA or a PDF, they'll all be here. And then you can use direct secure messaging to send them around to other providers, upload them or download them, whatever you need to do. But many EHRs require you to upload computable documents or clinical care documents in a separate place than they do the PDFs and things. But to the provider, they probably want to see all that in one place. To them, it's all a document, whether it can be interpreted by the EHR or not. So that's pretty much how we do that. I want to show you a little bit about how we do outcome measures. Let's see if I can get over there to. So we have the concept of various measure reports here. You can determine what quality measures you want to track, and which ones are of interest, and how they fit into what's important to you. We of course have all the ones that are required for meaningful use for your practitioners in your facilities to get their meaningful use credits. But if you have others like the CQL measures, we can put those in here, and they're not necessarily geared towards a patient. They're geared towards things you do with patients and using the electronic health record correctly. So any data is available in there. And by numerator and denominator, the denominator is usually the patient population, and the numerator is the number of people you conducted that on. And then you can set what you want these to be. The ones that you're seeing here are what would be required for meaningful use, but you can add others as needed. And you'll see all the measuring reports that you've pulled up here. And this actually, the CSV format, it's like this because this is the way you have to send them into the folks at Medicare. So you can just download them and send them right from here. But you can generate other reports depending on what's important to you. So I would assume in this particular case, we would just add a CQL column over here so that you can generate your CQL reports, and it would show you the status across the entire practice. But then again, like I'm not even touching on the analytics today because we just don't have time. But all this data, we can show you the analytics tools we use, and we can build analytics reports for you and graphics and things based on that. But we're trying to make it to where it's a tool you can use, that you can make your own analytics reports, because you probably don't want my canned reports beyond the stuff that's required for Medicare, of course. But you probably don't want my canned reports. You have special things that you're trying to improve on, so you'll build them the way you want them built. So we may help you with a couple of them just to get whoever's going to help with your analytics started. But to go from there, basically you have the capability to get to all the data and build whatever analytics you want. And we can do that in a separate demo. And I'd actually like to do, if we had a couple good use cases to show you how powerful those dashboards are, if we could come up with some use cases, how we could use the data on those dashboards on a daily basis. Like we'd build a couple templates for you just so you could see what it looks like mocked up based on your use case. So the other thing I wanted to show you real quick is some of the stuff we've been working on for the state of New York. We have the capability to do the whole HCBS assessment right in the system. So you just click on Enter Workspace. You go here. It starts instead of, you don't want to fill out a paper form. You fill it out here on the screen in the tool that you're used to. You would put in the assessment results, like, so if they need HBS assessment in order to even get the program started. But then the next thing after that is what services are they going to be authorized for. So you can, we've implemented all of the rules for the HBCS assessment. And again, part of what I'm trying to show you here is that this is, the system is highly configurable. We can take those paper forms that the state has, build them into the system very quickly for you, and move forward. So like, if we try to sign the person up for more than 3, it won't allow it because that's the state's agreement. Unfortunately, that can't be enforced on their paper form very well, so you'd have to wait till you submit that before you realize that you shouldn't have done that. So you put in, like, okay, so you sign them up for 3 programs, how often, and that sort of thing. And then once you've done that, you can sign the assessment here electronically. We'll create the PDF file for you and send it to the state. When they send the authorization back, which again comes in on paper, they'll send these couple of pieces of data. You'll have to fill those in. But it lets you track all the paperwork in the system. And then you can start building out the patient's individual service plan like this right here. So you pick the services. So we can build these things right into the system so that you don't have to send somebody out to external systems, fill out their paper forms. If you have something like this that you use all the time, it's no big deal just to create these right here. So let's just go ahead and put, just to fill this out. But I want to show you another way how we can, that I was looking at with your CQL data, which requires asking questions of the patient, and maybe in your case, the patient's caregiver or parent or guardian. So one thing that's interesting with our system is the data from the last note always shows up, or the previous form of the same type that you filled out. It always shows up in this pane, so you can see what you did before. And then for the one you're filling out, that's the section in the middle. And it was just like this with e-prescribing. And then the thing, as it's completing, it's going to show you what it's building over here. So if I went and added a change to family history over here, which you could change whatever these are, whatever type of family history intake questions are interesting to you or something that you track, you can put those here. And that it's configurable. It doesn't require a software developer or anything. And it's same thing with social history. Whatever you want to track, you put these things in here. The ones that you're seeing here are the ones that are meaningful use required. But again, that's again up to you. It's a configurable item. You determine what social history. Maybe it's are they, in your case, maybe it's are they living at home with both parents, or the parents divorced, or something like that. That sort of thing may be more interesting to your use case, and you want to track that. And you'd put that in here, and it'll just automatically update the social history form. But then once you're done with this form, you can just sign it and move on, and it will store it with all the other progress notes. And then, in this particular case, you can also send it to the state.
Also, if we go to the summary page, we can see which services he has. Everything on this page can be configured to your needs, like what you want to see and where. And let me just show you how that works. If we want to move things around on the dashboard, we just go to User Settings. We go to Modules. We can pick which modules are visible here on the side menu. But if we go to Patient Charts, we can decide how many columns we want and what we want in those columns. Like maybe I want my HCBS stuff over here, and maybe I want my conditions here, and I want allergies to come next. I'm going to push save, and that will all move around. Now I have my HCBS data right here. You can also see here that we can see the status of these sessions, where they are, how many we've had, alerts based on usage, that sort of thing. We also have many other modules that are useful and helpful in operating the clinic. They include a scheduling system, a system to manage claims, ADT management, direct secure messaging, the reporting, and an auditing capability. There are many other modules that you can add to your menu from right here. It just depends on what is available at your facility. If you offer lab capability or any of that, that's all can be right here. Let me show you quickly the claims module. Right here we can see a list of all of the encounters. Here we can see claims and their status, the ones that have been not sent, accepted, pending, and so on. And then we can also look at a particular claim. So even on the claim form, we can add coverage here if we find out they have secondary medical coverage or didn't have any coverage marked in the first place. We can see the codes that are available and the diagnostic codes and the codes associated with the visit, and the price, and if there's money to collect or not. And this is how we submit the claim. Pushing submit will send the claim off to the clearinghouse, which will then process the rest of the claim with whichever insurance provider is needed. I guess that's about it.
Well, thanks, Brant, for walking us through the software solution. We'd like to wrap up with just a brief description of our support structure. We offer a tiered support structure that allows us to optimize our response to you to make sure you're getting the availability and the functional operation that you expect and need. Any incidents or any questions at all that you have can be reported to us via phone, via email, or we can set up web portal so that you can enter questions and problems directly to our team. We can also tailor the customer support to meet your needs, anything from 24/7 round-the-clock support to 9 to 5 business day kind of support. In this way, we're optimizing our resources and your costs to meet exactly your needs. But with that, I'd like to thank you all for your time and for spending a little bit of time with us looking at our solution. And just a quick reminder that you can always visit us on the web at our website and contact us anytime you may have questions, or if you'd like to schedule an in-person demo one-on-one with us. Thanks very much.